Case, Bexitrol F has been playing a major role in Bangladesh for 2 decades. That means for 20 years, Bexitrol F has been catering to almost 1.3 lakh patients each and every month, and it is being exported to 32 countries worldwide. And we are proud to say that the quality we are providing in our local market is actually the same we are providing to the global market as well. It's the same, the best medication available in inhaler therapy. So when we talk about Bexitrol F, we say this is one of a kind. This brand in inhaler therapy is actually there is no comparison, and we are going to talk about few of our SKUs available. So we start with our Bexitrol F Optihaler. This is a conventional inhaler, but with an unconventional spacer. We understand that a spacer actually improves the coordination. So whenever we talk about HFA inhalers, coordination is a problem. And in this case, whenever there is a coordination issue, we almost always prescribe this product. This is an Uptaco. This is the most conventional and the best spacer available in the market without any doubt. But there are few problems. The basic problem is that many patients might find this a bit expensive or inconvenient in terms of portability. That means we cannot carry it always everywhere. Unlike the conventional inhaler, very easy to use, we can keep it in our pocket. So what we are providing with Bexitrol F Optihaler is just a small pocket size Optihaler spacer. This is not a conventional spacer. It is an unconventional spacer, but it will be better than the conventional inhaler alone. So what we are trying to say that instead of using the HFA inhaler single or as it is, we are providing a free of cost portable size, pocket size Optihaler that improves the coordination. But this is not similar to that of the Uptaco, because Uptaco is the best one. But if we want to say that we have the conventional inhaler, we have the Optihaler, and we have the Uptaco. So it goes like this. Conventional inhaler works, Optihaler works better, Uptaco works the best without any doubt. So what does Optihaler give in terms of the convenience? It is a pocket size portable spacer. We can carry it everywhere, anywhere. It synchronizes the inhalation technique. It exerts least mouth deposition and improves drug delivery system. We are going to see few of those in the data form. So whenever we talk about the lung deposition, each and every inhaler therapy requires this to be optimal. That means lung deposition has to be best. In this case, we can see that both salmeterol and fluticasone is being deposited in the lungs more compared to the inhaler alone. Also, when we talk about the mouth deposition, we understand that we require the lung deposition to be the maximum and mouth deposition to be the minimum. In this case, we can see that both salmeterol and fluticasone has almost 5 times less mouth deposition. Thereby, we can say that we are having better therapeutic outcome with minimum side effects. Moving on to our next product, that is our Bexitrol F dose counter. So the name itself is giving us an idea what it does. Dose counter gives us the facility of counting the dose with the inhaler itself. But the best part of our dose counter inhaler is not the counting facility. It is the last point that we have, that is the auto lock system. In our experience, we have seen many patients using the same inhaler even after there is no medication. They think the gas itself is the inhaler medication and they keep on using it. And then they come to you and complain that the inhaler is not working. So in this case, what we are providing is an auto-lock system. That means once the medication is no longer there, the patient will have to buy a new inhaler because he cannot or she cannot press it anymore. That means he will understand that there is no gas, there is no medication, so we need to buy a new inhaler. Next, when we talk about our affordability, Bexitrol F Bexicap has given us the opportunity to give the patients the best quality medication with a more affordable price. And why we say that this is the best medication? Because whenever we say that Bexitol F is the best, there has to be some sort of comparison or control with someone. In this case, we are comparing our product to that of the originator brand. And we have two data that gives us the actual data that tells us that yes, Bexitol F is similar or better than any other brands. In this case, the first one we say the powder flow rate. The powder flow rate is important whenever we talk about drug delivery system. And in case of Bexitol F Bexicap, the powder flow rate is similar to that of the originator brand. Also, when we talk about the proper amount of drug in each and every capsule, it is also similar to that of the originator brand. That means when we can say that yes, our product quality is similar to that of the originator brand, and it also works similar to that of the originator brand. Finally, when we talk about innovation, Beximco Pharma has always talked about innovation and has always depended on innovation. And right now in Bangladesh, the most innovative multiple dose dry powder inhaler is Maxel. This small pocket size multiple dose dry powder inhalation system, we call it the Bexitol F Maxel. Why are we calling this the most innovative? So we are going to talk about few of the data and then I'm going to show you why. Basically, this is the most easiest dry powder inhaler right now in the market. Why we call that? See, as per the data, when it was demonstrated for the first time to the patients, out of 100 patients, 74% of the patients knew how to take it in the first demonstration. When it was shown for the second time, 100%, almost 100% of the patients knew how to use this multiple dose dry powder inhalation system. And I will show you why this is the easiest one. So basically, the conventional dry powder inhalers are like this. We have the Bexihaler and we need to take out the capsule first like this. We have the capsule ready. We take out our Bexihaler spacer. We open the compartment. We put our capsule inside, close it, and then rotate it, and then use it. That means 4 steps: open, close, rotate, inhale, right? I'm going to show this to you again later on. But when we talk about the Maxel, there is no steps of taking out the capsules, putting inside, and then using it, because there are 60 capsules already ready inside this inhaler itself. We just open and hear the click sound, that means it is ready. We inhale and we just close it. That's it. Open, inhale, and close. It's the easiest 3-step ready to use dry powder inhalation system. Only thing that we need to remember, let's say I have opened it and I did not inhale, right? I did not inhale. So I just need to throw away the powder like this. Because if I do not throw the powder, the compartment will be locked. That's the only. Okay. Let's say this is the Maxeller ready to be used. I just pull it, ready to be used. I inhale and then I just close it. If I do not inhale, I just throw away the powder like this. That's it. But normally when a patient opens it, he or she actually uses it. That's it. So these were the SKUs, but always the major role is played by the formulation. So whenever we talk about formulation, be it tablets,